So, herpes viruses have been around for a really long time, and we think all animals have herpes viruses that infect them. There are herpes viruses that infect mollusks, and there are herpes viruses that infect people, and everything in between. Herpes viruses are exceedingly common. And I know there's a stigma associated with herpes viruses. And I think that's unfortunate because they're really, really common. And if there's a stigma associated with it, then people don't talk about it. If people don't talk about it, then it doesn't get treated, um, and it just spreads further. The hallmark of herpes viruses, the and I don't use the word always in virology a lot, but the hallmark of herpes viruses is that all of them go latent, and the infection remains in your body for life. Now, they can go latent in different types of cells, and so we'll talk about the tropism of different herpes viruses and where they go latent. But all herpes viruses are going to remain latent in your body, and some of them are more or less likely to reappear later on in life. So, the organization of the herpes family, we've got alpha, beta, and gamma herpes viruses. And then we've got some other groups of herpes viruses that infect other animals. Right, so we are going to focus on the herpes viruses that infect people, but I do want to make a note that even though we don't have extra time in the semester to do a veterinary unit, and some larger universities you can take veterinary microbiology, and you'll learn about all of the important pathogens that infect domestic animals, livestock, and pets, and so forth, but also of commercial interest. So there are herpes viruses. This is an oyster farm, and there's a herpes virus that's running through oyster farms and causing lots and lots of economic damage. And there's a good feature in your textbook about this that you guys should read. Now, we are going to focus on the varicella virus, VZV. This causes chickenpox, herpes simplex viruses, CMV, human herpes viruses 6 and 7, EBV, and then Kaposi's sarcomas associated herpes virus. So those are the ones we're going to focus on. We're also going to talk briefly about herpes B virus that infects monkeys, and some people are more at risk if they're in contact with monkeys for acquiring that. Alright, so this is table 11.2, and I rearranged it a little bit. Table 11.2 is a good one for you guys to focus on. So we've got herpes B. This is a monkey virus. This is really rare in people. It primarily replicates in monkeys, but when it does get into people, it's fatal about 50% of the time. And this virus is of just particular concern for people who interact with monkeys a lot. So this could be zookeepers, or this could be veterinarians, or this could be actually in some places of the world temple workers when there's lots of monkeys in temples. Or this could be tourists, if tourists get too close to the wildlife. They always tell you, don't feed the wildlife, but people think monkeys are cute, and they want to get close and take their pictures. And monkeys are cute and adorable, but they're also vectors of disease and pestilence, just like small children. And monkeys also really like to steal shiny things. So if you approach a monkey and try to get close with your cell phone is shiny, the monkey's likely to steal your cell phone and then run up a tree, and you'll never get it back. So you should avoid getting too close to monkeys to avoid herpes B, and also to keep your cell phone. Okay, So our alpha viruses, I've grouped up here. Human herpes virus 1 or herpes simplex virus 1, so HHV1 or HSV1. This primarily causes cold sores. It can also cause other herpes infections, mat herpes, or it sounds better to say herpes gladiatorium, other herpes infections, Whitlow. Also, it's important to note that HSV1 can occasionally cause genital herpes, and HSV2 can also cause cold sores. So HSV1 or human herpes virus 1 and HSV2 can both cause cold sores and can both cause genital herpes. This is a tend. So most cold sores tend to be caused by HSV1, and most genital herpes tends to be caused by HSV2. Also of note, occasionally these viruses can lead to encephalitis and occasionally keratitis, infection in the eye. Now, herpes viruses are the most common cause of viral encephalitis and viral keratitis. That being said, it's still really rare, and we'll talk about this as we move through the lecture. All right, human herpes virus 3, or varicella zoster virus. This is chickenpox, and chickenpox occurs in children, and later in life it can reoccur as shingles. Now, these viruses, these alpha viruses, can replicate in a wide variety of cells. They have some pretty broad tropism, and so they can replicate in epithelial cells, they can replicate in some white blood cells, they can replicate in neurons. So you've got a pretty wide tropism here. Then we've got the beta herpes viruses, and so we've got human herpes virus 5 or CMV. CMV is one of the most significant opportunistic infections out there. CMV also is the cause of congenital deafness and birth defects. This is actually a way more common problem than some other congenital abnormalities or defects, but there's a lot less awareness about CMV than some other things. All right, now CMV also occasionally causes mononucleosis, and occasionally can lead to more serious infections in the immunocompromised. This can be really serious if you have AIDS. CMV tends to replicate primarily in monocytes, white blood cells, B cells, but especially if you're immunocompromised, can also replicate in a wide breadth of cells. Its tissue tropism can also be kind of broad. So for tissue tropism, CMV is grouped up here. You may be hearing a child scream right now. Just ignore it like I am, and we're going to move on. Alright, so then we've got human herpes virus 6 and human herpes virus 7. So human herpes virus 6 causes 6 disease. Remember how I mentioned briefly, I think I've mentioned briefly, I'm losing track of time with all the days running together and being at home all the time. I think we've talked about somebody a long time ago just listed out all of the common diseases that children get, 1, 2, 3, 4, 5, 6, and this happened to be the 6th one. There isn't really any better reason why you've got 6th disease and 5th disease. It's just that's the order they were numbered. So we'll talk about these together a little later on. These can cause roseola, which is a disease that very small children get. Most children get by the age of 2 or 3. Very rarely you can have more severe complications. This usually doesn't cause severe recurrences later in life, but it can, especially if you're immunocompromised. And herpes, human herpes viruses 6 and 7 are generally going to replicate in monocytes, macrophages, and B cells. All right, our gamma herpes viruses. We've got human herpes virus 8, or Kaposi's sarcoma virus, and EBV, or human herpes virus 4. So we've got HHV8 and HHV4. Right, these viruses are going to infect B cells. So human herpes virus 8 is asymptomatic or causes a very mild disease in healthy people, and in areas where this is endemic, we think this is transmitted mother to child, and usually doesn't cause significant infection. But if you're older and or immunocompromised, it can cause cancer and occasionally Castleman's disease. We'll talk about that. And EBV is primarily known for causing mono or mononucleosis. It can also cause Burkitt's lymphoma, and we'll talk about that later. It's most associated with Burkitt's lymphoma if you have a co-infection with something else. So this is a really good review chart for you guys to go back through for the exam. If you guys made yourself like a blank version of this chart and then tried to fill it in before the test, that would be a good idea. All right, moving through these pathogens one at a time. So looking at HSV1 or human herpes virus 1 and HSV2 or human herpes virus 2. So herpes simplex virus 1 or human herpes virus 1. Right, these primarily cause what we refer to as herpes or cold sores. So in both cases, you get these vesicles, this rash that blisters and crusts over. And if this occurs on the mouth, we've got cold sores. And if it occurs in the genital region, we've got genital herpes. And again, HSV1 is the primary cause of cold sores, and HSV2 is the primary cause of genital herpes, but they can both do both. HSV1 is going to stay latent in the trigeminal nerve, and then when life is just really down on you, herpes comes back. Herpes is life's big middle finger to you. So you get your initial infection, and the initial infection is usually the worst because you don't have an immune response to it yet, and it's painful. These blisters are painful, and then they go away, and they stay latent in the trigeminal nerve. And then whenever you're under stress, and this could be emotional stress, like you just lost your grandmother, or you just lost your spouse of 50 years, or this could be physical stress. So you just had a really bad case of the flu, or you just had a really bad case of MRSA, or heck, maybe you got stuck out in the desert too long and you overheated, and you got, or you fell asleep on the beach while you were sunbathing, and you got super sunburned, right? So physical or emotional stress, that's when you get your outbreak of herpes. Now, during that, the prodromal period before the outbreak, you'll normally feel like a tingling sensation or a painful sensation kind of underneath the skin. That's the virus coming back along your nerves, and then you get an eruption on the skin, which is usually more mild than the first because you do have some immune response to it at that point. Normally, your first eruption is going to be a week or two after your initial exposure. And then the periods of latency, it can be weeks, months, or years. When you are truly latent, if you're actually in a latent period, the virus is not making active particles. The virus is just sitting as some DNA in the latent nerve cells, and it's got some other genes turned on that prevent it from actually producing infectious particles. So if you're truly latent, you're not infectious. However, you are infectious during an outbreak, and you're also infectious in that prodromal period. So in that, we'll say 3 to 4 days before an active outbreak, you are infectious. So you don't necessarily need to be having the active vesicles, lesions, in order to be infectious. So it is possible to have herpes, and if you're really careful and if you're on medication, to not spread it to your partner. But you do have to be really careful because you can be infectious in the days immediately preceding an outbreak. Now, these infections can be treated with acyclovir. Acyclovir is a chain terminator, and there's some other similar antivirals. They all end in clovir. All of those work against herpes viruses. Another thing to note about herpes viruses, very rarely they reactivate and can cause encephalitis, or they can reactivate and cause viral keratitis, which can lead to blindness. And those are medical emergencies and need to be treated very aggressively. That being said, this is still rare, so if you have, a cold sore, that is technically possible the next time you have an outbreak, but it is really unlikely. Another thing to note about genital herpes is this can be transmitted from the mother to a new baby if the mother is in the prodromal phase, or in an active outbreak if she has a vaginal birth. And that is fatal a very significant portion of the time. That is very, very serious for the infant. The infant gets a systemic infection, they get encephalitis, and that is fatal a very large percentage of the time. So if a woman is pregnant and she has herpes, genital herpes, she can still give birth vaginally if she wants, but she needs to be on antiviral medication, like with acyclovir, and needs to be in a truly latent state. If she has an active outbreak or thinks an active outbreak might be coming on, then you need to deliver via a cesarean. All right, chickenpox, right? So human herpes virus 3, or varicella zoster virus, chickenpox. This is a disease of children, primarily of children. It can be worse if an adult becomes infected with it, or if you're immunocompromised. Now, normally, this is a relatively mild illness, and most kids get over it without serious complications. But occasionally it can be really serious. You can get secondary infections. You can get pneumonia, or the pustules that when they break open can be an opening point for bacterial infections. Very rarely this can cause encephalitis and be very, very serious. So most of the time this is a acute self-limiting disease, but occasionally this can be very severe. And there are a variety. Some kids are going to have 100 pustules, and some kids might have 500. Right, so there's a little bit of a variation in how serious this is for kids. I never got chickenpox, so I've been exposed multiple times. I'm immune. My mother's immune. Her father was immune, but the rest of her family was not. So we've all been exposed to chickenpox many times, but we've never gotten it. But my sister was really unlucky, and she got it super, super bad, and she had the pustules in her eyes and in her ears and in her nose, and it was really, really bad, and they were considering hospitalizing her. It was really serious. Now, chickenpox is an interesting infection because it's the only herpes virus that spreads through airborne transmission, and I should have made a note of that. Both herpes 1 and 2 are spread through direct contact. But chickenpox is actually spread through the respiratory mucosa. So when your doctor tells you you're not supposed to scratch the pustules because they itch really bad, I'm told, and they can be painful, and you're told you're supposed to scratch them because when you scratch them and they break open, that releases the virus into the air and then people breathe that in. So this is the only one that is spread through airborne transmission. All right, so the virus, you breathe it in, it gets into your blood system, and then it travels through your lymph nodes. It can actually replicate in your macrophages and your monocytes, and it uses your monocytes as like a taxi to move around your body. And during this period, you don't really have outward symptoms. The virus is just spreading throughout your body. And then it spreads to your nerves, and then it spreads to your epithelial cells. And that's when you get the rash coming on and you get a fever. And then you're really miserable with a fever and the vesicles for a few days. And then the fever subsides, and then the vesicles kind of a blister and scab over. Now, the other reason it's important to be kind to the blisters is because they can lead to scarring. So the treatment, I think, how many of you guys actually are old enough to have gotten chickenpox yourself? Some of you guys may have gotten chickenpox. Some of you guys may have gotten the vaccine. The kind of common treatment for this at home is oatmeal baths, and really trying to ease the itching and the discomfort of the blisters. I remember sitting in an oatmeal bath with my sister, and she was just covered in pox, and I didn't have any, but my mom just kind of treated us the same. And so I'm sitting in this thick oatmeal bath, which is really weird. And I remember being a terrible little sister, and I was just like poking at the dots on my sister and trying to count them up while she was absolutely miserable. So yeah, apparently during that time I was not a supportive child. Moving on, most people get chickenpox, or they get the vaccine nowadays, and then you go years and years and years and years and years, like decades, like you're in your 60s or 70s, and your immune system is waning, and then you have some sort of stressor, some sort of physical or emotional stressor. So again, this could be you get a really bad bacterial infection, or maybe I don't know, you missed the bus in the middle of the winter and you got frostbite in your foot, or you got fired from your job, or some big other emotional stressor. Remember, herpes is life's middle finger, and so you're really miserable, and that's when shingles reappears. So shingles erupts on a dermatome. Shingles is going to reactivate because it stays, remember the virus stays dormant, and this stays dormant in your nerves, and it reactivates along a dermatome. Usually it's just one dermatome, but occasionally it can be multiple. And so this is kind of showing you the patient, the front and the back, and so this would erupt here and wrap around the body here, and so you get this rash and a stripe, along your body. And so this can wrap around your sides, this can go over your shoulder, this can even come around and go over your face. And when this happens, it can go over your eyes, and again, this can lead to keratitis. Keratitis, and this is a medical emergency. This can lead to blindness, and it has to be treated very, very aggressively. Rarely, this can lead to encephalitis, which is also life-threatening and a medical emergency. These outbreaks, they're exceedingly painful. Shingles is no joke, and these can last for a long time. So 2 weeks if you're healthy, and a month if you're immunocompromised. And for some people, even after the rash goes away, you still have severe pain. So that's post-herpetic neuralgia. So shingles is very serious, very, very painful, and getting a vaccine, the shingles vaccine, it's essentially a booster for your immune system so you don't get shingles. Okay. We're going to pause here, so we'll pick up part 2 of the herpes virus lecture in the next video.